Right. So, hi, I'm Dr. Ismail, a senior resident working at Krishna Institute of Medical Sciences. So I'll be presenting a case we conducted on intertrochanteric femur fractures, where we compared two sort of implants. Right. So moving on to the introduction. Okay, just a minute. Right. So, with hip fractures, very commonly, almost 1.6 million annually, and they're projected to be more than 6 million by 2050, especially in elderly women. Coming on to the nature of the injury, majority of them are extra-articular fractures, and majority of them are unstable and they do need surgery. The treatment, however, has evolved over quite some time. Initially, with just management with traction, moving on with the DHS, which used to be a standard implant previously, and now the new generation intramedullary nails. Uh, so for this study, we compared two intramedullary nails. One was a TFN, which uses two screws, and one was a PFN, which uses a single helical blade. Although there has been multiple studies, but there's no sort of consensus on which is superior to other or if they're same. So the study, we conducted this from 2021 up to June 2022. We included sort of 100 patients in our study, 50 for each implant, and analyzed them over a period of 18 months. We assessed the functional score, the surgical time, union needed for the fracture to heal, any intraoperative blood loss, and any complications. So the inclusion criteria, again, it was for geriatric patients aged 50 to 85, Boyd and Griffin type 3 unstable fractures. If you can see the image below, the type 3 was what we sort of included in our study because they are the ones that require surgery. Patient presenting within 1 week of injury and who are medically fit for surgery. We excluded any pathological fractures, any previous hip surgeries, polytrauma, any associated other femur fractures, or patient who had non-ambulatory status before the injury. Right, so we had follow-up evaluations for each patient at 6 weeks, 3 months, and 6 months. And as mentioned earlier, we had assessed the operative time, intraoperative blood loss, the time for radiological union, the Harris hip score, which was sort of a measurement of the functional outcome, and any post-operative complications. Coming on to the results of the study, the demography shows that for the mean age was 58 in the TFN group and 60 years in the PFN group. There wasn't much difference as far as the age was concerned and the site of the fracture was concerned, but they were not significant. We also measured the intraoperative blood loss, and it came up to 71 minutes on an average for the TFN and 65.5 for the PFNA-II. Then it does look like there is some difference, but the p-value did come to be more than 0.05. The blood loss again was 253 for the PFN implant and TFN for 275. Again, the p-value didn't show much significance. Among the 100 cases of PFNA-II group operated patients, the average time for surgery, like I mentioned, was 65, and those for TFN was 71.5. Again, it does look on paper, there's some difference with TFN and PFN, but when we did this statistical studies, they did show that it came out to more than 0.05. Coming on to the radiological union, which was assessed by series of X-rays that were done on each follow-up, and also clinically, we assessed for any tenderness to the patient. If there was no tenderness, it showed signs of union. And with TFN, it came out to be 13.9 weeks on an average, and PFNA-II was 12.4 weeks on an average. We did conduct the statistical values, and it did come about more than 0.05. Again, on the Harris hip score for the comparison for each implant, we did that at 1.5 months, 3 months, and 6 months. The TFN and PFN at 1.5 months was 26.5 and 28.6 respectively. For 3 months, it was 46 for TFN, and again, same 46 for PFNA-II. 6 months, it was 71, and for PFNA-II, it was 67.8 months. So there was not much difference that we could find as far as the functional outcome was concerned with both the implants. Moving on to the complications, obviously, TFN is a shorter implant as compared to PFNA-II. So it did have some sort of thigh pain as compared to the other side. There was superficial infection in 2 cases of TFN and one for PFNA-II. Screw pull-out and cut-through was observed in TFN. It was 4 cases, and for PFN it was 2 cases. This could be attributed to the osteoporotic bone that's already present in geriatric patients. But however, yeah, the screw pull-out was quite less in PFNA-II, which uses a single helical blade. Coming to the literature, although there are a lot of studies that have been done, but none of them gave a clear-cut uh, idea on, both of these implants. And these are commonly used all over the world, especially in the Southeast Asia, quite commonly used. We did compare our results to other studies. One similar one was by Kashid and Baksho, where he did compare TFN and PFN, and he did show that there was no significant difference in the age groups. Another one was Bajpai et al. He did find that the operation time was almost similar in both the implants, and it is sort of comparable to our study. Another one was by Bojan AJ et al. He did compare the Harris hip score. That's a functional outcome, and his studies show that there was no statistical difference between the functional outcome, and that's what something we also found in our study. Right, coming on to the conclusion. I mean, PFNA-II did demonstrate a better functional outcome, shorter operative times, less blood loss, and a lower complication rate compared to the TFN. However, it was not statistically significant. We did conclude from the study that both of them are an equally effective implant in the treatment of unstable intertrochanteric fractures, and there is no clear superiority of one implant over the other. Just to point out, the only significant difference they do have is the price. One implant that's PFNA-II is quite costlier as compared to TFN. Hence, if an economic point of view is concerned, especially in population of Southeast Asia, then the TFN would be a better implant as it's economically cheaper and it will still give you the same functional outcome as the more expensive PFNA-II. So the references for my study, which was conducted. Thank you. If any questions, please.